And today I will be assessing the neurologic and musculoskeletal system. First thing we need to do is to identify the patient. This is to make sure that this is the right patient that we will be assessing. And explain the procedure to the patient. The purpose of this procedure is to explain. And then I perform hand hygiene to avoid contamination. And help the patient to address and define the patient's health. And then survey or observe the patient's overall hygiene and physical appearance. In assessing the neurovascular system of the patient, first thing that we need to do is to assess the patient's mental status. First is by evaluate the patient's orientation to person, place, and time. And then evaluate the patient's level of consciousness. Then after that is to assess the patient to the memory by recalling past experiences or past memory. Next is to assess the patient's abstract reasoning by let the patient explain the word that or the sentence that I will be the rest of it. So Mama is your own understanding of the sentence. Time is gone. Assess the patient's abstract thinking by asking the patient. After that is to assess the patient's ability to understand written or spoken words and ability to follow commands. Evaluate the patient's ability. After that is to be assessing the patient's radial nerve function. First is by asking the patient to close her eyes and occlude one nostril and ask the patient to smell the substance that will be added to by first asking the patient to close the eyes. After that is I will be placing my hands on the patient's shoulder as she resists it against the resistance. And then place my hand on patient's cheek while she pushes it. After that is to ask the patient to move her neck freely by asking the patient to touch his chest using her chin. With the patient's chin to shoulder, right ear to right shoulder, and left ear to left shoulder, and tilt the back as far as After that is to, I will ask the patient to close her eyes and ask the patient to identify the object that I will be
ibalik lang ako tanan kasi ko sa dio ano kayo sara ako ang wrong jadi lang ko baguhan.
And then I will be asking the patient again to close her eyes and write a one number on patient's palm and ask the patient to guess the number.
Pa-friend. Ha? Pero limpyo ko kayo. Remind ko. Ha? Walang manarap ko din.
After that is to assess the patient's deep tendon reflex in a specific area using a reflex hammer. First is the wrist area.
Assess the functioning of the patient. Evaluate the patient's ability
and then the antecubital area.
kanang
And then they triceps reflex.
Reflexes.
Balik.
And then they under the patellar reflex.
Wala.
And then the Achilles reflex.
Where's the Achilles? Tendon. Okay. Masakit?
After that is to stroke the sole of the patient's foot using the end of the reflex hammer. If the patient feels any
Oh, thank you, Dok.
Ako sunod. Siya na stool, so...
after that is to I'll be asking the patient
Ay,
to
dahil.
dorsiflex or plantar flex both of the patient's foot.
Ang bag ng brown dahil. Ito na sumos. Ang boy isulan siya dahil. Palihog dahil ha.
Nagulo ko eh.
Dorsiflex. And after that is to I will be observing the patient as she walks with regular gait, and I will ask the patient to stand up. And with two on the heels.
Hindi ka na. Oh.
And heels on the toes.
Oh, okay. So, balance wa. Oh, sa imong pasyente, normal dili. Okay.
And after that, we'll be asking the patient to stand up again to perform the Romberg's test, observing for the patient's swaying and ability to maintain balance for 20 seconds while the patient closes her eyes. After that, as the patient, upon observing to the patient has able to maintain the balance. After the procedure, we will proceed to assessing the musculoskeletal system of the patient by asking the patient to extend her arms to the side with the palm facing up and down rapidly. And observe. After that, is to ask the patient to flex the upper arm and resist against the resistance from opposing force related to cross balance during the procedure.
Hindi mo nakamot siya dahil. Sige.
After that is to inspect and palpate the hands, fingers, wrists, and elbow of the patient, assessing for swelling and tenderness. Now we will be assessing the musculoskeletal system, starting with asking the patient to. After that is to I will be asking the patient to squeeze my two fingers. Then ask the patient. Then after is to ask the patient to stand up and perform the straight leg test, one leg at a time. After that is to ask the patient to be able to perform the test abduction laterally and adduction medially. After that is to I will be the patient squeeze asking the patient to sit down again and ask the patient to raise their thigh against the resistance with one leg at a time.
Oh, correct. Anak. Na.
After that,
Jud pakita jud ay ano dai.
After that, with the patient in standing position. After all the procedure, we'll be assisting the patient in a comfortable position, perform hand hygiene, and document the findings of the assessment.